COVID-19. Time for a visit with Dr. Kevin Kavanagh. He's a retired physician and also founder of Health Watch USA. Good morning, Dr. Kavanagh. Dr. K, we call him. How are you, sir?
Oh, I'm doing good, Jack. Thank you for asking. How are you doing?
Doing all right. I got another call from the White House yesterday, and I don't ignore those, Dr. John Fleming is assistant to the president for planning and implementation. He also advises Chief of Staff Mark Meadows and is involved in the coronavirus task force. He will be our guest tomorrow morning at 8:35. I'll find it interesting to see his take on coronavirus. So you're in good hands, buddy. You're with good company, as always.
What? That sounds good. I would certainly ask him about infrastructure investment in our schools and ventilation. This will take some dollars and I think stimulate the economy at the same time.
All right, I will do that. I understand there are names of schools, numbers of Kentucky COVID cases among students and staff are going to be released.
Well, that's correct, and I think that's very important. We release the data for head lice. Knowing if there's outbreaks in schools would be extremely important. But I should add, and this is kind of a old note that I've been drumming for a long time, is that the same should be true for a lot of our healthcare systems on releasing data for antibiotic-resistant bacteria and all dangerous pathogens. Everything needs to be transparent. Schools, however, are of utmost importance because, as we discussed before, we really want to guard the safety of our young. That is of paramount importance.
Now, the schools that have closed so far, UNC Chapel Hill closed, Notre Dame. These young people have moved in, gotten settled, gone to parties, didn't wear masks, didn't socially distance. A bunch of people got sick, and now they're sending them all home.
Yes, that's correct. And I was scared of that. This virus has been, kind of poo-pooed as its importance in the young, and so they're off partying and ignoring this. And what's not being realized by many of the young is that even though the chances of being hospitalized are reduced as compared to the elderly, it is still there. And a significant number of them can get very sick in the hospital, and a few can even die. And the long-term sequela from this virus is really severe. And so if you do get very sick, you may get into a condition like a long hauler has developed, or you may develop some heart damage, lung damage, etc. It doesn't happen in everybody, but it happens frequently enough in the younger individuals that they really do need to be careful and take precautions.
And also, I wondered if you would have any information about this supposed quick and affordable saliva-based COVID-19 test where we don't have to have the Q-tip up our nose.
Yes, I think that is really key, and it could be somewhat transformative. This was developed by Yale scientists, been just approved by the FDA. Projected cost is less than $10, and of course it is easy to use. It is quick to take. I'm not sure how long it takes to process the specimen. It is a PCR test. Some of those are very quick, taking minutes. Others can take days. But the big thing here is imagine school-age children, especially in grade school. Getting a Q-tip up their nose would be just an enormous Herculean task. But you could easily get them to spit into a cup. In fact, it may be hard to get them to stop spitting. So, these are your kids. So I think this really has applicability in schools and could allow testing and really widespread testing in our schools, which, similar to professional sports, could be key in getting them open safely.
Yeah. Now tell us about, the president mentioned something he was looking at, and he was looking at it because it was a recommendation from the MyPillow guy. What's that about?
Yeah, it's another drug. It's on, I would say, about the same level, or if you could be worse, is worse than hydroxychloroquine. It's supposed to be a cure-all, and I saw an interview of him, and he really appeared like a snake oil salesman. Stated that all of these things had been done when he couldn't document where they had been done or who did them, and questionable safety. Outcomes was just word of mouth or friends that he knew. And so it was really pretty scary, but it was the same narrative of hydroxychloroquine. and he's out pushing that. And it's an over-the-counter kind of a herb-like entity that I guess some people can take. But it really does have cardiac toxicity. And there's been articles published on this, that you can find on PubMed. And for me, it's quite frustrating how this misinformation is taking hold. People are believing it, and they're going out and getting cures that don't work when we do have drugs and treatments that look very promising. So at this point, please don't fall for these, what I consider snake oil salesmen.
Oleandrin, I think is what it's called.
Yes, that's correct.
And finally, this morning, the U.S. Food and Drug Administration got involved with pool testing. What is up with that?
Well, and this is another thing that was approved a couple of weeks ago, is pool testing. And I think if you combine that with the testing of the saliva, you really have a strategy that could work in schools. Pool testing is where you pool or group together a number of different specimens that you've taken and then test them all at once so that you're only doing one test on, let's say, 10 people. And if it's negative, they're all negative. Now, if the test is positive, then you have to test each one individually. But as far as screening a class or screening a pool of students, now there's a group of students that you're keeping together in a class to make sure everybody's clear, you can do that now with a single test. And so that, I think, would be a great advance. That, along with a better way of getting the specimen, that of the saliva.
Now, one more thing, and this, I think, is why there's so much discourse around with the whole coronavirus 19 thing, is we had a story last week about these COVID neck gaiters, they're called, those lightweight, stretchy face coverings that you wear around your neck, pull over your face. Last week, scientists said they were useless, probably more harmful than helpful in stopping the spread of coronavirus. Now the new study says, no, they're okay, they work. So you get the feeling that they're just throwing the stuff on the wall just to see if anything sticks, and I think that's why people have become distrustful.
Well, and I think you're right. There's a lot of mixed messaging, but you need to realize that science isn't 100% accurate when it does studies. Studies can go either way, and that's why you need a group of them. You need to look at which ones are done well, and then come to a conclusion or a consensus of what works, what doesn't work. And this takes some time. We've had a lot of mixed messaging, but this virus is new, and as you learn more and more about the virus, you figure out which studies were not done as good as they should have been done. You start to change your guidance, but you also become more accurate. To be honest with you, Jack, we've only been fighting this really hard for about 6 months, and I've been amazed at the advances which medical science has made, both in testing, in treatments. We've got a vaccine which is nearly done and completed, and some are entering phase 3 trials right now. And so all of this is pretty remarkable. But if you follow it every day, you'll get setbacks, you'll get frustrated, and this is kind of normal. But to be honest with you, any sort of a cloth mask isn't going to provide the wearer the type of protection they're going to want to protect themselves. It will provide some protection, but the main reason to wear a cloth mask is if you're an asymptomatic carrier, you do not transmit the virus to others. And so that is important. As we discussed before, goggles are also a good idea.
People aren't going to do that, though. I'm sorry.
Well, I know that's going to be a long haul, but that will add an added layer of protection.
All right, thanks. We'll talk to you Friday.
Thank you very much, Jack.
You bet. Dr. Kevin Kavanagh, founder of Health Watch USA.